Good afternoon. I'm going to call the meeting to order. This is the joint oversight hearing of the Assembly Committees on Health and Aging and Long-Term Care. California Department of Public Health, what progress is being made to improve nursing home oversight? Thank you all for being here. Thank you to all my colleagues for your presence and participation, and I want to thank in advance all of our panelists for their participation in today's hearing. I'm Assemblymember Rob Bonta. I'm honored to serve as the chair of the Assembly Health Committee, and I'm very pleased to be joined by my esteemed colleague, Assemblymember Cheryl Brown, who is the chair of the Assembly Committee on Aging and Long-Term Care. Together, we will co-chair today's hearing on nursing home oversight performed by the California Department of Public Health's Licensing and Certification Program. The department's licensing and certification program is responsible for regulatory oversight of California nursing homes. It performs this duty through facility licensure, certification, periodic inspections, and complaint investigations. It also oversees certain nursing home staff who provide care to residents. I think all of us in this room can agree that nursing home residents are among our most vulnerable members of our community, and that the state has an obligation to ensure that they receive safe, quality care. Regrettably, there have been long-standing concerns with the manner in which the department provides oversight of California's long-term healthcare facilities, most notably due to an ongoing pattern of untimely complaint investigations and an accumulation of a very large complaint backlog. As a result of these ongoing concerns, our respective committees held a joint oversight hearing in January of 2014 to examine the licensing and certification program. It's been over 1 year since that oversight hearing, and it's time to check back in. Our committees have new information to evaluate from a state auditor report, as well as an assessment that was performed by a department contractor, each of which identify numerous areas of improvement. Also, the department has been vocal about its commitment to reform and improve its nursing home oversight function, and has developed a work plan and taken other steps toward reform. So in my view, the goals of today's hearing are to, 1, evaluate the department's progress towards improvement, 2, ensure that the department adheres to an appropriate timeline for fixing the program, and 3, determine what supports or assistance the department needs to advance its improvement efforts. We have a robust agenda today where we will hear from the department, the state auditor, the LAO, stakeholders representing consumers, labor, and the nursing home industry, and others. The safety and protection of California's nursing home residents is absolutely critical and a top priority. With that said, I look forward to a productive discussion today, and I'll turn it over to my co-chair.
Thank you, Mr. Bonta. And thank you, fellow members, stakeholders, staff, participants, and any viewers that we may have. You know, I'm a caregiver, so I understand the whole situation of what it means to take care of someone. I'm a wife, I'm a consumer, and as I said, I am a provider of long-term care. And I was elected to represent and stand up for the constituents of the 47th Assembly District. You know, many people have heard me say that 10,000 people a day in America are turning 65, and that'll happen for the next 17 years. In California, it's 1,000 people a day for 17 years. So our nursing needs are going to be exacerbated. Now, while not everyone needs to have nursing home care, it's estimated about 90,000 people are going to be are in nursing homes right now, and about 60,000 of those are being paid for by Medi-Cal. That's about $11 million a day, or about $4 billion a year. I want to start with a quote from my favorite author, John C. Maxwell. He said, "Leadership is a matter of attitude, and it is contagious." Now, I'll spare everyone the humor behind the irony about the contagions in the Department of Public Health, but I think you all get my drift. There's no doubt that we have an enormous stake in nursing care that that nursing care residents receive given the high costs that are shouldered by the public. We as legislators have a right to demand and expect a level of oversight that honors that public investment. Today's hearing is another of the many illustrating the tepid and weak responses of state regulators. Regulators entrusted with the safety of our most vulnerable and most dependent adults. While the Department of Public Health's complaint investigation failures have grown to shocking levels, the public is rapidly losing faith that government can properly respond to the desperate pleas or help from our constituents. Last year, we heard that there's a backlog of 11,000 complaints that had not been responded to nor investigated. On February 27th, 2014, the U.S. Office of Inspector General attributed much of the preventable harm to substandard treatment, inadequate monitoring, and a failure to delay the necessary care. On October the 31st, 2014, the state auditor issued a highly critical report on the department's complaint investigation system. That revealed that DPH had the 11,000 open complaints. Many of them had high priorities and had remained open for an average of nearly a year. Now, can we think about that just for a moment? A year. After someone was concerned enough to take on the burden of reporting, they wait an average of a year. Can anyone be confident with the findings of an investigator a year after the event occurred? Enough is enough. We must fix this disgraceful situation, and based upon the information we've received, and despite all efforts made by the administration, it appears not to be enough. The department's own self-assessment identified a troubling lack of leadership at licensing and certification. Yet, we still have some of the same poor leaders serving in our positions there and throughout numerous district offices. So I come back to my original quote. Leadership is a matter of attitude, and it's contagious. If we were to seek the opinions of workers in DPH, we would find out that they have been bitten by the leadership bug. This is unacceptable, but I will hold my final views until the end of the hearing. I will oversee the first panel, which will consist of a presentation by our Legislative Analyst Office. The LAO has provided fiscal and policy advice to the legislature for more than 70 years. It's known for its fiscal and programmatic expertise and nonpartisan analysis of the state. Mr. Sean Martin, if you will come forward. Thank you. Yeah, I forgot to do that part. You could do it.
If you might, I just want to invite my colleagues, any members, if you would like to make any opening remarks at this time, this is an opportunity to do so. So I just want to open the floor for any members. Freddie, Assemblymember, yes.
First of all, I'd like to thank both chairs for having this very important hearing regarding care in our nursing facilities. Members, I can attest for my own experience over 30 years as an emergency responder on the type of treatment and care in some of these facilities that are being given to our patients, our elderly and disabled individuals that are in these facilities. Because as you know, that when patients go bad as far as their condition, they're calling 911. And time again, have I responded to several of these facilities throughout my career down in the San Gabriel Valley where I've been working. The basic questions on being cared for with patients don't seem to be being cared for. And what things are really it's really frustrating to us as first responders, just the basic questions as far as how long has this patient been in this condition can't even be addressed, where they don't seem to know, or one of the things they most commonly refer to as, I just started my shift. I don't know how long this patient's been this way. So therefore, trying to improve a patient's condition without really getting full information from the medical staff that's there. And that comes to another question of mine as well. We talk about the licensing of the facilities and what they go through, but sometimes we question of the care workers themselves that are, whether they're CNAs, nurses, and whatnot, that if they're properly licensed as they should, because in those types of situations, it's an emergency situation, things get a little stressful and hectic, and when they don't seem to be responding to basic questions, it makes us question their type of service they're being provided. So I can tell you stories upon stories of things that have occurred in those situations, but not all of them are like that, but a good portion of them are. So hopefully out of this hearing today, we can better address this issue and really close the gap of addressing the issues with these complaints with facilities and patient care. Thank you.
Thank you, Assemblymember Rodriguez. Any other members like to make any opening remarks at this time? Okay, thank you. Okay, let's move to the panel.
Thank you, chairs and members. Sean Martin with the Legislative Analyst's Office. I've been asked to give an overview of the Department of Public Health Licensing and Certification Program, and I'll be speaking from this handout today. You should all have a copy of it before you. So if you'll turn to page 1 of the handout, I'm going to give you a quick overview. I'll be going over the Licensing and Certification Program, recent incidents that have gained the public's and legislature's attention, legislative oversight of the LNC program, and also the governor's proposals for addressing issues in licensing and certification. So now if you will turn to page 2, I wanted to mention that the LNC program licenses and certifies certain healthcare professionals. These include nurse assistants, home health aides, and hemodialysis technicians, and the licensing of nursing home administrators. But the main focus of our presentation today is licenses and certification of health facilities. So the field operation branch of the LNC program is responsible for regulatory oversight of health facilities, and it fulfills this role by conducting periodic inspections and complaint investigations of healthcare facilities to ensure that they comply with federal and state laws. The U.S. Department of Health and Human Services Centers for Medicare and Medicaid Services contracts with the LNC program to evaluate facilities that are accept Medicare and Medi-Cal and to certify that they meet federal requirements. The LNC program licenses or certifies over 7,500 healthcare facilities and agencies in California in 30 different types of licensure and certification categories. It investigates tens of thousands of complaints every year. These may be complaints from people who are in the facilities, patients, could also be complaints that come from families or friends. And then it also investigates entity-reported incidents. These are incidents where the facility self-reports that it has done something. The LNC program is located within the Department of Public Health Center for Healthcare Quality, and if you turn to page 3, you can see that we provided an organization chart of the Center for Healthcare Quality, and one of the major branches there at the top is licensing and certification field operations. I'm moving now to page 4. The LNC Field Operations Branch works out of district offices. It's divided into 7 regions, and within each region there are as many as 4 district offices. Generally, the staff in the district offices work in the vicinity of that office. The state contracts with Los Angeles County to perform licensing and certification workload in Los Angeles County, and it's done by the Health Facilities Inspection Division within the Los Angeles County Department of Public Health. The LNC staffing is based on a workload estimating model. I want to say that this workload estimating model is a work in progress. There were a number of problems with this estimating methodology that were identified last year. The Department of Public Health is working to correct these problems. The LNC workload is largely determined by 3 drivers: the facility count, the activity count, meaning the number of pending and projected activities for L&C staff to perform, and the standard average hours. This is the average number of hours needed to complete a licensing, certification, or investigative activity. And now if you'll turn to page 5, the L&C program is funded mainly with special funds and federal funds. The governor's budget proposes $255 million in total funds, $3.8 million in general fund for support of the L&C program in 2015-16. This is a $32 million increase above estimated 2014-15 expenditures, and this increase is mainly due to governor's proposals to expand L&C activities, which I'll discuss a little bit later. So recent incidents have gained the public's and the legislature's attention. An investigative reporter uncovered that in Los Angeles County, they had an unofficial policy to close out certain complaints about long-term care facilities without properly investigating them. The Los Angeles Department of Auditor Controller issued the results of its investigation of the Health Facilities Inspection Division's performance and concluded that the division had a significant workload backlog and lacked a mechanism to effectively clear the backlog. In a report, the Department of Public Health found that Los Angeles County had significant problems prioritizing complaints, which had led to delayed investigations. And in April 2014, the Federal Centers for Medicare and Medicaid Services notified the Department of Public Health that it would withhold $503,000 of the Department of Public Health federal funding allocation until the Department of Public Health achieves certain benchmarks related to the management of its contract with Los Angeles County. Ultimately, the $251,000 in federal funds were withheld. There are also statewide program issues. In June 2012, we received a letter from the Federal Centers for Medicare and Medicaid Services expressing concern with the ability of the Department of Public Health to meet many of its Medicaid survey and certification responsibilities. And ultimately, the federal government withheld $138,000 in federal funds as a result of this. In response to federal concerns, the Department of Public Health contracted with Hubbard System Consulting for an organizational assessment of its effectiveness and performance. The report contains 21 recommendations to allow for meaningful, measurable improvements in the licensing and certification program. I'm not going to go into any of the recommendations because I understand that they're here to testify later. Similarly, this California State Auditor released a report that found that DPH has not effectively managed investigations of complaints related to long-term health care facilities. Again, they're here, so I'm not going to go into any details on that report. So turning the page to page 8, legislative oversight of the licensing and certification program. There have been a number of oversight hearings, and the legislature enacted Chapter 31 in 2014, SB 857, that included several requirements intended to facilitate legislative oversight. One was that the Department of Public Health will report quarterly on the status of long-term care facility complaints, investigations, state relicensing, and federal recertification surveys and vacancy rates within the licensing and certification program. They have been posting this information to the website. I looked at it today. I know from that report that as of December 31st, 2014, 3,514 complaints were received in the first 2 quarters of this fiscal year, and 3,065 complaints were completed during the same time period. So the posting of this information has allowed us to look on a quarterly basis and see where the department is in terms of clearing its backlog. The legislature also required the Department of Public Health to report on assessing the possibilities of using professional position classifications other than health facility evaluator nurses to perform licensing and certification survey or complaint workload. As of now, the report is overdue. The department has not provided it. health facility evaluator nurses are almost one half of the positions in the licensing and certification program, and they do much of the workload when it comes to licensing and certifying facility. So if there were the possibility of using other position classifications to perform this workload, it might provide the state with more flexibility and allow it to clear the existing backlog on a more timely basis. And so that was the reasoning behind requesting that information. And also, the Chapter 31 required that the Department of Public Health will hold semi-annual meetings for all interested stakeholders to provide feedback on the licensing and certification program. Finally, on page 9, the governor has 4 proposals to address LNC issues, $378,000 special funds to permanently establish 3 state positions to perform quality improvement activities related to the Los Angeles County contract, an increase of $2 million in special funds to implement quality improvement projects recommended in the Hubert System Consulting Report, an increase of $9.5 million in special funds to augment the Los Angeles County contract to perform licensing and certification activities in Los Angeles County, and an increase of $19.8 million for 173 permanent positions and 64 two-year limited term positions. This is a total of 237 positions to perform the state licensing and certification work. And this would bring the total established positions within the LNC program from 1,078 to 1,315. The Department of Public Health estimates that with 237 additional positions requested, program staff could complete the current pending investigation workload in approximately 4 years, while also addressing new workload and avoiding any new cases from aging. That concludes my presentation. I'm happy to answer any questions if you have them.
Did I hear you right? You said it's going to take 4 years to clean this up?
Yes.
What are the people who are there now doing if you have to hire new people? And what's going on?
The people who are there now are investigating the backlog of complaints that have carried into the current year from prior years, dating back several years. They're investigating complaints that have come in during the first 2 quarters of the current year. And so they're performing that workload. They're also out doing their licensing and certification workload as well.
Mr. Gibson?
Thank you very much, Madam Chair. Can you give me those numbers once again? Did I hear you correctly? You made mention about 12,000 cases are backlog?
Oh, let me go back.
And what that number represents a total, or that's to date?
So the numbers that I gave earlier were for the information that is an example of information that they're currently posting on their website. Was that the information you're talking about? So I may have misspoken. I said as of December 31st, 2014, 3,514 complaints were received in the first 2 quarters of 2014-15. And of those complaints, 3,065 were completed. Some of those may have been carried in from previous years of the ones that they completed. So if you subtract the 3,065 from the 3,514, you can see that the backlog has actually been increasing over the first 2 quarters of this year, and those are for skilled nursing facilities, intermediate care facilities for the developmentally disabled, and some other long-term care facilities.
We may get into this as we have dialogue. Are you able to give any examples, or maybe someone will be able to give examples of some of those cases that are backlog? I'll be interested to hear some of those cases that are backlog.
Sure. I don't have access to specific examples.
But I'm sure someone who heard that question will certainly be queuing themselves up when they come up to the table. Hopefully they can provide an answer to that question. Thank you.
Mr. Chavez.
Thank you very much, Chair and Vice Chair, for holding this. This is an important issue. In my district, we have a significant senior population because we have Camp Pendleton there, and a lot of military, retire there, and so we have a number of homes. And so have visited all of them, quite frankly. What I'm interested in is, with the same thing as discussed earlier, you're going to increase your manpower by approximately 30%. That's the governor's proposal. And my question is, do we have the right organizational structure to solve? You're just throwing more money and people at the job, but is there another way to do this organizationally? For example, what's Florida do? They got an elder population. How are they handling it? Are they doing it the same way we're doing it?
I haven't looked to see how Florida in particular is organized. So in terms of how it could be handled differently, I talked earlier about the report that we're awaiting to see whether we can use different position classifications other than the registered nurses, who are the health facility evaluator nurses, to perform the same workload. If we've had difficulty as a state recruiting for that position in the past, so if we were able to recruit social workers or some other position classifications to do that, we could potentially restructure our personnel and complete the workload more quickly that way. As for actual restructuring of the, I believe there are 7 regions and the different district offices. We haven't contemplated that, nor have I seen a proposal to do that.
So,
Well, in our
let me chime in here real quick.
But let me finish, and you
All
can
right.
have all the time you want to have. I appreciate that. We have an org chart that you gave us for your whole structure, which is rather cumbersome. But having ran a state agency myself and understanding technology changes and how things manage, has this state organization ever changed itself in the past 3 to 5 years?
I think maybe that question would be better directed at the administration, because they may have made some organizational changes that I'm unaware of as working at the Legislative Analyst's Office.
Okay, just because it was part of your chart I was looking at, I'll wait till then. Okay, thank you.
Mr. Mathis?
Sorry, Member Chavez. To go with what he just asked you, he asked, if you guys have looked at like Florida system, do you guys look at the other state systems at all to do a comparison on what they're doing and how they're doing it versus how we're running things?
Yeah, our office has not conducted such an analysis, no.
Okay. And then one other question while I've got you. On page 4, you list, workload estimates and models and all of that. What are the factors that you're looking at when making those estimates?
So
because to say you're making estimates is one thing. I mean, I can make an estimate and say, I think this is this far, but what are the factors? What's your ruler? What are you using to measure that?
Well, for example, how many facilities, the activity count. They do time and motion studies of the people who are performing the activities, and they try and determine what's the average length of time it takes to do a certification survey or a licensing survey of a specific type of facility. And then using that information, they use that to project forward what they believe the workload for the next year will be, looking at how many facilities and different types they're going to be visiting in that next year.
Okay.
Thank you. Mr. Bonta? You're going to the next panel?